From the dawn of civilization to 2003, 5 exabytes of data were created. The same amount was created in the last 2 days. So what is an exabyte of data? It's 1 billion gigabytes. And you can think of just 1 gigabyte of data as the equivalent to a full-length movie burned onto a CD-ROM. So if we wanted to simulate the amount of data that we all create in 2 days, we could take these 1 gigabyte CD-ROMs and we could line them up here starting in Providence and line them up all the way down to Newport. If we would do this 1,319 times, that would equal the amount of data that we're creating in just 2 days. And knowing that this 36-mile drive is pretty far by Rhode Island standards, it's safe to say that this is more trips to Newport than your average Rhode Islander will be making in their lifetime. So what does this mean to us? It means that big data is big, really beyond the amount that we can comprehend. And the amount of data that we store from files and emails and social media keeps growing every year. In a span of less than 2 decades, we've gone from a state of data scarcity to a state of complete inundation of information. But the real question is, how are we going to use all of this data? With great power comes great responsibility. Some of you may recognize this quote from Spider-Man. After Peter Parker is bitten by a radioactive spider, this awkward teenager now has superhuman strength. He can spin webs and scale buildings. After he finally gets the courage to stand up to the school bully in a fight, his Uncle Ben sits down and warns Peter Parker that just because he can hurt people does not mean that he should. Well, if you look back through history, you find that this quote actually is not original to the Spider-Man comic. In fact, history has documented that the same message has been said by numerous US presidents, Winston Churchill, back down through the French Revolution, and even back to biblical times. Is this past and ever-present theme in humankind a warning to us for our future? We're living in exciting times. Never before have we had access to so much information, but as a society, our data is both our power and our responsibility. It's easy to think of using data responsibly in very black and white terms. On one hand, don't use data to violate people's privacy, or do use data to help people. But could the true risk of our access to so much information be that we don't know how to use it? Back when I was 16, I drove a car for the very first time. It was a 1986 Dodge Caravan in the parking lot of a Dairy Queen. I was feeling very cool. With some coaching from my friends in the back seat, I slowly eased my foot on the gas to feel how much foot pressure was needed to make the car move forward. So after a few slow tours around the parking lot, my friends dared me to test the performance of this precision machine. So first, I was encouraged to put my foot on the gas to make the car speed up and then quickly put my foot on the brake before we got to the edge of the parking lot. Being unfamiliar with the feel of driving, it was thrilling to be able to make the car speed up like that. Now, here's where things went wrong. My next dare from my friends was to use the gas pedal and the brake pedal like I was playing a game of whack-a-mole with my feet. So as the van lurched forward and jerked to a stop over and over again, we were all having a great laugh, until suddenly the van wouldn't move anymore. Confusion turned into fear as I realized how many hours I'd be working at that Dairy Queen to pay for what I just broke. In order to drive a car, we need to learn about it first. We learn how to steer, we learn the rules of the road, we learn how to pump gas. We learn what it can do, drive you to soccer practice, and what it shouldn't do, donuts in a Dairy Queen parking lot. We don't just give teenagers keys to a car and hope that they're going to figure it out. We teach them. Well, the same approach applies to how we're using big data today. Just because we have access to all this information does not mean that we know how to use it. Understanding the source of data, the limitations and how to interpret it is necessary in order for us to unlock the amazing potential that data has to make our world a better place, to solve health problems in a third world country, to tackle widespread addiction to painkillers, to find a cure for cancer. We can use data as a tool to guide our decisions with better information than we ever had before. But in many cases, we're treating big data like a Google search. We want to find the quickest path to an answer, and we especially look for answers to confirm what we would like to be true. So how can everyday people like us use the power of data for good? We can start by understanding it. And from a data science perspective, we have a fascinating example of the limitations of data that's affected us all. In fact, much of what you need to know about the limitations of big data can be learned by looking at the 2016 US presidential election. On November 7th, 2016, the eve of the United States presidential election, most election forecasters were predicting that Hillary Clinton had anywhere between a 70% to as high as a 99% chance of winning the election. Virtually none of the polls were predicting a Trump win. This led many people to ask, why was the data wrong? How did big data fail us? Well, whether we're talking about your president or not your president, there are a couple of reasons to explain what happened. Both campaigns relied on numerous sources of data to make projections, both public and private, recent and historic. Not only was a lot of data used to make projections, but talented people were interpreting it. But polls, like any study, are limited in the data they can collect. Pollers called landlines instead of cell phones to survey voters. They surveyed people who may not have shown up to vote on election day. There was a very high non-response rate. In fact, 91% of people surveyed didn't even respond to these polls. And there was also a phenomenon during polling which is dubbed as shy Trumpers, or people who simply were not honest about who they're going to vote for. Polls do the best that they can to collect as much information as they can, but what they do collect will always be, in relative terms, a tiny sampling of imperfect data. And knowing that our elections only happen once every 4 years, the historical data that we need in order to make projections is quite limited. And the less complete your data is, the higher your margin of error. Bias plays a bigger role in data interpretation than many of us think. The Pew Research Center found that about 2/3 of adults get their news from social media. But if you think back to pre-election chatter, very little of the talk online reflected support for Trump. In fact, some analysts have blamed technology for creating an online echo chamber that was not reflective of the conversations that were taking place offline, particularly in rural parts of the country. So if you, like me, were surprised by the election, you're not alone. And this wasn't the first time that the world was surprised by voting results. In fact, just 5 months before the US election, the Brexit vote decided that the United Kingdom would leave the European Union, a vote that virtually no one predicted. And if you compare the Brexit headlines to the 2016 election headlines, the similarities echo history repeating. So the moral of all of this is that we can't put our blind faith in big data. The data alone has its limitations. But the good news is that once we understand it, we can harness it to do great things. We have an example happening in healthcare right here in our backyard. Opioid addiction has been called the worst health crisis of our time. With 142 Americans dying daily, opioids' death toll is equal to September 11th every 3 weeks. People who are caught in the clutch of addiction end up in this cycle of being treated and streeted. And this cycle happens over and over again, in part because care providers just can't see when their patients are checking into an ER. Because they don't know, they can't reach out to help. Well, the little state of Rhode Island has a big solution to this issue. This system, called CURRENTCARE, allows doctors' offices, hospitals, and treatment centers to talk to each other, to share healthcare information in real time, including substance abuse data. It's a patient-centered system that allows any Rhode Islander to opt in to be included. And you can designate a loved one to be contacted if you ever are checked into an emergency room. This information also gets back to your doctor so he can reach out once you're discharged to ensure that you get the care that you need. Putting information like this in the hands of care providers who need this help us to move from a healthcare system that is reactive, that waits until people end up in an emergency room to provide help, to one that is proactive, where doctors can reach their patients to help to break the cycle of addiction. This same system helps the elderly in Rhode Island. If your grandmother has a bad fall and ends up in emergency care, you, as her designated contact, would be alerted right away. Doctors in the ER would have access to her health records, including all 7 of the medications that she's on, which is vital information in emergency situations. And because her doctor would be alerted when she's discharged, he's able to reach out to provide proactive care. Doctors who use this system have reduced avoidable ER visits by 18%. It's a win for us all. In a disjointed healthcare system where the right hand doesn't always know what the left hand is doing, using health data responsibly helps us to put keeping people well as a top priority. So, what legacy will we leave behind by the way that we use our data? Will our grandchildren look back and say that we used our access to information to make a better world for them? Data is our wealth, our resource with limitless potential. And what we do with this power is up to all of us. Thank you.